Atrial fibrillation is a kind of irregular heartbeat that can cause heart failure and stroke, and it's estimated that over 2.3 million Americans suffer from this condition. To avoid or limit an atrial fibrillation episode, some foods are to be avoided altogether, but others just need one's intake to be curbed as much as possible for any improvement in the condition. If you've been diagnosed with atrial fibrillation, one of the best ways to ensure that it doesn't worsen is by avoiding or reducing the following 10 foods from your diet. Salt raises your blood pressure, which can increase your risk of atrial fibrillation. The American Heart Association recommends people with high blood pressure eat less than 1,500 milligrams of sodium a day. The recommendations range from 1,000 to 2,300 milligrams per day depending on the age and health status of the person in question, so make sure you are aware of what is safe not only for you but all those around you. At blood pressure greater than 120/80, which is roughly the healthy range in most cases, you're at an increased risk of developing atrial fibrillation, a condition where two chambers of your heart beat at irregular intervals. Although there's no known way to prevent atrial fibrillation completely, the American Heart Association recommends maintaining a healthy diet and lifestyle to help keep blood pressure under control, which includes avoiding foods that are high in salt, as they can raise blood pressure. Grapefruit juice has powerful health benefits and can help us better overcome some of the most common health problems. Studies have shown that it is a great source for people seeking treatment for osteoarthritis, asthma and even weight loss. Naringenin, a chemical found in grapefruit juice, can decrease the effectiveness of two common antiarrhythmic medications, codarone and ticasin. Alcohol can trigger an attack of atrial fibrillation in people who have a heart condition or diabetes. Too much alcohol consumption may cause heart problems for some people. It's safer to limit your alcohol consumption to 1 drink or less per day, but if you're going to drink more than that, know that 1 drink is considered 1 12-ounce beer, 5 ounces of wine or 1.5 ounces of liquor. It's best to check with a doctor before increasing the limits on what you imbibe too frequently. Caffeine increases your heart rate and makes you more susceptible to an AFib attack or other heart-related issues. Studies have found that people who suffer from AFib should incorporate more fiber into their diet plan in order to prevent heart-related health issues. Refined grains and processed pastas can raise the levels of LDL cholesterol, which is extremely unhealthy for the circulatory system and may lead to heart attacks or strokes. High blood pressure and obesity are common causes of arrhythmia or atrial fibrillation. People with arrhythmia need to avoid foods that are high in fat like meat and dairy products like cheese, butter, and margarine, as they can trigger an arrhythmia episode. If you're taking warfarin to treat said condition, don't eat too many leafy green veggies because their vitamin K content has the tendency to reduce warfarin's effectiveness. For example, spinach is good, but leafy vegetables like kale and asparagus that contain high levels of vitamin K can affect the effectiveness of warfarin, if not taken with a meal containing something to aid its absorption. Have it with foods rich in vitamin C and E. This helps the warfarin drug to work effectively in fighting heart-related problems. It's important to eat a healthy diet rich in potassium, as this nutrient plays an integral role in maintaining a regular heartbeat. Low levels of potassium may lead to an abnormal heart rate or arrhythmia. Foods like potatoes, bananas, and prunes are great sources of potassium, so make sure to add them to your diet. Foods that contain the compound tyramine can cause an AFib attack by raising your blood pressure. It's best to avoid foods rich in tyramine like cured meats, fava beans, cheeses, and fermented cabbage. People who are prescribed medications like warfarin, which is an anticoagulant drug often used to prevent blood clots, need to monitor their consumption of multivitamins, as some vitamins are known to cause adverse effects.